Since I was a small child, I've had issues eating fatty foods. I would become extremely sick eating fried chicken and other high-fat foods such as onion rings and buttermilk pancakes. I would develop severe GI pain, my abdomen would swell up, and then I would vomit profusely. I was very grateful when I was a teenager and was able to make my own meal decisions. I would eat grilled chicken and I would choose salad over French fries. In late 2009, I started having stomach pain and nausea when I would eat food. Since I was recently diagnosed with postural orthostatic tachycardia syndrome, which is abbreviated as POTS, I was assured my stomach issues were just a normal part of having a medical condition which affects my autonomic nervous system. Many people with POTS have slow stomach emptying. As the weeks passed, I could eat less and less. Finally, in February 2010, I went to my primary care doctor. I was doubled over in pain. I could only tolerate clear liquids. I was sent to the hospital. At the hospital, I informed the physician I thought I was having issues with my gallbladder. The doctor disagreed. He told me I was too young to have gallbladder problems. I remained in the hospital and could only eat clear liquids. In a divine miracle, a woman came to the hospital on a Saturday morning. It was determined she needed to have her gallbladder taken out. The surgeon was called in to perform the procedure. The doctor thought since he was doing one gallbladder removal, he would also take out another patient's gallbladder and my gallbladder. We were both slated to have gallbladder removal surgery on Monday. After surgery, the surgeon came into my room. He told me he had no intention of taking out my gallbladder until Monday, and out of the 3 patients, my medical case was ranked the lowest. However, when he did the surgery, my gallbladder was inflamed, infected, and about ready to rupture. My gallbladder was 3 times the normal size. If the surgeon would have waited until Monday, my gallbladder would most likely have ruptured and I would most likely have died. The surgeon said out of the 3 patients, I was the one who truly was the medical emergency. After surgery, my pain subsided for 1 day, but then it came back as I tried to eat. I struggled to consume calories due to severe upper GI pain. In the weeks to follow, I did endless research trying to figure out what was causing my pain. I carefully documented what I ate and any associated symptoms. I discovered whenever I ate fat or protein, about 30 minutes to 2 hours after eating, I developed severe upper abdominal pain, nausea, bloating, and I would sometimes vomit. I came to the conclusion I had pancreatitis. When I saw my GI doctor, I told him I was having issues eating fats and proteins. I told him my pancreas was the issue. My doctor did not believe me. To prove to my doctor it was my pancreas causing my upper GI pain, on the way home from the medical clinic, I stopped at the store and bought a small 3-ounce piece of fish. Upon arriving home, I cooked it. 4 hours later, I was in the emergency department with an acute pancreatitis attack. My GI doctor looked at me in disbelief when he saw me in the hospital. I told him, "See, it is my pancreas making me sick." My doctor asked me, "How did you provoke a pancreatitis attack?" I said, "This is what happens every time I eat fat or protein, except I usually do not come into the emergency department. I stay at home and fight through the pain." The doctor agreed it probably was my pancreas. He referred me on to a specialist. When I saw the pancreas specialist, he did an upper endoscopy called an endoscopic retrograde cholangiopancreatography, or ERCP for short. An ERCP is a procedure in which a scope is placed down your throat, through your stomach, and into your small intestines. The endoscope can then travel up the biliary tract and can also examine the pancreas. Testing revealed I had high pressures in my bile ducts. My bile ducts were stented open and my sphincter of Oddi was cut. My diagnosis was sphincter of Oddi dysfunction type 2. The doctor felt confident he had solved my medical case. I was referred back to my GI doctor. In the years to come, I continued to have severe issues with my pancreas. I was hospitalized for pancreatitis countless times. Eventually, doctors decided my repeat pancreatitis attacks qualified me for the diagnosis of chronic pancreatitis. In 2010, I had a feeding tube into my intestines which failed after 3 months. I could not tolerate the feeding tube formula. I was then switched to IV nutrition called TPN. Several years ago, a pancreas specialist ordered a genetic panel which looked at genes which were specifically known to cause pancreas issues. I had 6 mutations on 5 genes. The pancreas doctor nearly fell off his chair. He said he had never seen so many mutations. When submitting my genetic test, a genetics counselor was flabbergasted that my mom, grandma, and great-grandma all had chronic pancreatitis. He wanted to do a special case study on my family because he was sure we had a specific gene which caused pancreatitis, which his laboratory was not testing for. More than 90% of my pancreas has been destroyed from having pancreatitis attacks. And without TPN, I would die from malnutrition. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye. My doctor felt confident he had solved my medical case. Hello.